So today we're going to talk about chronic phlegm in the back of your throat. To really figure this problem out, you want to think like an engineer, not as a medical professional. When you do research on this, you're going to quickly find out that it's all about, again, suppressing the symptoms, and even classifying these conditions based on their symptoms. This makes this symptom sound like a disease, and unfortunately, they're not going deep enough into the root causes of these issues, and also letting you know what the more common causes of these symptoms are. What I'm going to do is take one symptom, chronic mucus generation in your throat, and just trace it back to the most likely cause. With this chronic mucus production, you can have post-nasal drip. You can have chronic coughing more at night than during the day, which I'm going to cover why that is. You can definitely have hoarseness or a scratchy throat. You can also experience the sensation of a lump in your throat, or something stuck in your throat, and you're not sure what it is, or even a sore throat when you really don't have an infection. To take an engineering point of view, they're going to look at a cause and effect relationship. They're going to really look at the logic behind this problem instead of just taking this tip of the iceberg symptom and matching a medication for it to suppress it. You could have an allergy. You could have a virus in your sinuses producing this mucus. But a more likely cause would be something related to two other symptoms, which I'm going to get to the root cause of. One would be GERD, which stands for gastroesophageal reflux disease, where you have acid coming up through this valve at the top of the stomach, and it's coming up through your esophagus, or this other condition called LPR, which stands for laryngopharyngeal reflux. The basic difference between GERD and LPR, because they're both very similar, is that the valve is not closing. With GERD, we're getting acid that comes up into the esophagus, but with LPR, we're getting acid that comes up higher into the vocal cords and into the back of the throat. Each one of these conditions is classified as a certain condition that's treated directly, usually with antacids and other medications that suppress acid in your stomach. If you have mucus in your throat, you want to ask yourself if you have all these other symptoms that are related to that. With GERD, you would have heartburn, belching, regurgitation, excess mucus, throat irritation, a lump in your throat, and difficulty breathing. When acid comes up through your throat, your ability to get oxygen dramatically decreases. You may have difficulty swallowing sometimes, post-nasal drip with that, and it's worse when you're lying down at night because that valve again is not closing correctly. You may have food allergies, which I'll talk more about. With LPR, you're gonna get a lot of those symptoms, but you may also have a metallic taste in your mouth, and more irritation in your vocal cords, like hoarseness when you're trying to talk. Before I go deeper into the root cause of these issues, I want to talk first about some of the treatments that can even cause the condition and aggravate it even more. For example, antacids have a big side effect of constipation, even acid reflux. Then you have these other medications that work a little bit differently. They're called PPIs, or proton pump inhibitors. They basically stop the enzymes that produce acid, and also have side effects of constipation, gas, risk for stroke, and risk of getting C. diff, which is an infection because it's a pathogen, palpitations, and even high blood pressure. Another side effect is hypergastronemia. What is that? That is too much gastrin, which is going to cause too much acid in your stomach. Here you are trying to get rid of your acid by taking a solution that's giving you more acid. It doesn't make sense at all. Another problem with these treatments is that they will remove acid, and now you're going to have a difficult time absorbing minerals like calcium and magnesium. Now we have a problem with bones, muscles, and the list goes on and on. But of course, there are other solutions too. You can get surgery to tighten this valve even more, but there are some slight minor complications like inability to belch or burp, increased gas in your digestive system, and a greater need for more antacids and those PPIs that I just talked about. Ultimately, the optimum solution to something should not give you a bigger problem than you started out with. Let's talk about the most likely cause of this valve not closing, giving you GERD or LPR. Not too much acid. It would be an acid deficiency, low hydrochloric acid. When the concentration of acid in your stomach is lower, the valve doesn't close properly. In fact, it can open up. But when the acid starts increasing, when you start digesting things like proteins, the top of the valve should close very, very tightly if everything is working correctly. The root cause of this valve not closing is basically that you don't have enough acid in your stomach. That is the underlying reason. Because you have acid reflux, you're thinking, wow, I have too much acid. I need to get rid of this acid. So I'll take an antacid or do something to reduce the acid. But the root cause is actually that you don't have enough acid. Hydrochloric acid in your stomach is a very important fluid for many different things, especially within your immune system. One of the purposes of this very strong acid, which should be between 1 and 3, is to kill pathogens. Believe it or not, your stomach is very sterile. Nothing can live because that acid is so strong. This is one of the barriers that your body puts up in the immune system. If we can kill pathogens that come from our food into the stomach, and prevent them from going down to the rest of the tract, we have a very good defense against these pathogens. But if we have weak acid in the stomach, pathogens can escape and get into the system and create all sorts of problems in the lower part of the digestive system. Even in the small intestine, you can get what's called small intestinal bacterial overgrowth, which occurs because you didn't kill the microbes at the stomach level. Another very important purpose of hydrochloric acid is to break down proteins fully. If you don't have enough acid in your stomach, you'll get incomplete protein digestion and start to create stress in the other parts of the digestive system because they have to produce more enzymes and do different things lower in the tract, which throws off your whole digestion. If you compound this with inflammation in the gut and you have something called leaky gut syndrome, these proteins go right into the little holes where you have leaky gut, and your immune system starts creating antibodies against these proteins. That's the start of autoimmune diseases and allergies. The third reason why we need hydrochloric acid in our stomach is for our ability to absorb minerals. Without that pH, the minerals don't travel into the body that well. This is one of the underlying reasons why people are anemic or have mineral deficiencies. They cannot absorb minerals like calcium, magnesium, potassium, zinc, and iodine. This strong pH also triggers things in your pancreas to release certain enzymes, as well as in your gallbladder to release bile. Without this concentrated hydrochloric acid in the stomach being at the pH it should be, the entire digestive system starts to go downhill fast. On top of everything else, the sensing mechanism doesn't allow that valve to close tightly, and then the acid starts regurgitating. You may even get regurgitation of bile up into the stomach. Both hydrochloric acid and bile can then regurgitate up to the esophagus and into your throat. This irritates the back of the throat and puts you in a constant state of mucus production, which is trying to protect against the strong acid that is dissolving your tissues. What I'm talking about is the most likely root cause of this mucus production, this chronic irritation in your throat that makes you cough. Now that we know that the solution is very simple, because we don't want to necessarily suppress the symptom, we want to fix the root cause. We want to now increase the amount of acid in the stomach. By the way, you're gonna have to figure out with the help of your doctor how you can start to wean off some of these antacids. If not interested, just ask them this one question. What are the long-term effects? What are the chronic effects of taking antacids over a period of time, and what's really behind these problems? You'll probably be curious to find out what they say, but it'll probably be something along the lines of, well, it's just stress, it's just genetics, and as we age, most people just have these problems. The way to get your acid back is to take something to start building up the hydrochloric acid. The best remedy is betaine hydrochloride. You'd want to take between 3 to 4 to even 5 to 6, even 7 right before you eat. That's what I would recommend. Here's the problem with certain types of people that take this. If you have an ulcer because this condition has gone on too far, or if you have gastritis, there's inflammation in the stomach, and you take betaine hydrochloride, it's gonna make it worse because the tissues are inflamed. In which case you're gonna have to heal the lining of your stomach first, which could take anywhere between 2 to 3 months before you start adding more acid to the system. But you need to understand the mechanism here. You need to know that ultimately you want to acidify the stomach and get it back to normal. If that is the case and you have an ulcer or gastritis, you can watch that video. I will put that link down below. You're gonna probably benefit greatly by taking zinc carnosine. If you don't have an ulcer, taking betadine hydrochloride can greatly help you. In addition to that, there are other things you need to do because the foods that you're eating probably are not helping you. The biggest offender for this problem is grains. What's wild is that if you look this up, they will tell you to consume grains to improve your acid reflux. But in reality, you're gonna find that it makes it a lot worse. There are a lot of things in grains that are inflammatory, create sensitivity, allergies, autoimmune conditions, and even lower your immune system, while dumping a lot of omega-6 fatty acids into the system. A typical grain has like 20 or more times the omega-6 than it does the omega-3, which are anti-inflammatory. You're basically dumping a lot of inflammation into your system when you consume grains and consume animal products that were fed a lot of heavy grains versus grass-fed, grass-finished animal products. I'm just trying to get you to think with this and think outside the box to see if you can start to sort out your own diet and what you need to change. It's essential also to do intermittent fasting and not follow the, well, just have 5 or 6 small meals throughout the day. No, you don't want to do that. You want to do intermittent fasting because the more you do intermittent fasting, when you fast for a period of time, at least 16 to 17 to 18 hours by skipping your breakfast, you can now give your digestive system a chance to rest, heal, and recover, because it's not constantly being triggered by foods. Another big cause of this entire problem, and I'm talking about low stomach acids and a lack of bile salts, which can inhibit your ability to digest fats, is a vegan diet. When someone's a vegan, many times, they consume a lot of grains and a lot of foods that tear up their digestive system, and they don't consume a lot of animal fats. Because they're not consuming a lot of animal proteins, they might not have the triggering of this hydrochloric acid. The combination of all these inflammatory foods, and the missing nutrients in a vegan diet, can create havoc on your digestive system. That being said, there is a correct way to do a vegan diet, so I'm not opposed to doing it correctly, but I am opposed to doing it with all the different fake meats, soy protein isolates, grains and sugar, etc. Now, I hope there were some good takeaways from this video, but I think the next most important video for you to watch would be on hydrochloric acid. Check it out. I put it right here.